Well, on Saturday when we're doing the weekend debate, I was talking with Mr. Ashford here in the studio, my studio, and we were umming should we do the Monday? But I think there's enough to be going on. Certainly, it's been another interesting time. We're recording this on Monday. Another vaccine in the UK. Again, does this alter where we're going, which one we're going to take when it comes available?
Well, obviously it's very encouraging that the vaccines are moving forward so quickly now. I think the key point is it will be a mix of vaccines. So there will be supply obviously coming through all the time. So we will be utilising all the various different vaccines that receive market approval.
But of course this one is saying 70%, but builds up or something, so that each one brings a different thing to the market. It must be difficult to know which one to go for.
It does, there's a mix, and like I say, that's why there will be a wide range of different vaccines that we will be actually using. But equally, we need to, as I've said before, see the scientific reports behind. So although you've got, as you say, the 70% and then build up, we need to see what the difference is between the different vaccines in terms of antibody response, how potentially long-term that antibody response is, how it worked in the cohorts that were placebo and also those that weren't placebo, and how it interacts with people of different age groups as well, because one of the key things that has been looked at with vaccines is, in people who have lower immune systems, who are older, will the vaccines have an effect? Now, the encouraging news from the vaccines announced so far, particularly one particular vaccine, has said that yes, it has a huge effect in the older age group.
It's the Oxford one, isn't it?
Yeah. But we'll need to actually look at the scientific data around that.
So will it be a nice issue, this, that this group that signs off on things? I mean, I know you have to legally bring it in here and to give them indemnity and that sort of thing, but you don't have scientists here who have to go through any trials.
No. We in the Isle of Man, we're a small island of 84,000. We're never going to have that level of expertise, so we do rely on the UK in that regard. But as I say, these vaccines have got to go through both the clinical safety checks and also the marketing authorisation in the usual way.
And you have to sign it off, in the Isle of Man.
And then we will sign off that we're happy enough with that in terms of our position.
It's interesting, isn't it, that now we're talking about so many different options. So there's a way forward. I mean, it's going to be more of an educational issue, isn't it, with getting people to take it to some degree. It just seems that there's so many people who are doubting now, still, to go forward and have that injection.
Yeah, I mean, there is people out there who will doubt. The key thing I would say is that although things have actually moved quicker than they normally would in a vaccine development, all of the vaccines have had to still go through the 3 clinical stages that they normally would. They've still got to pass safety standards. They've still got to go through the marketing authority. None of that has changed. So while it has been sped up and some of those stages have been, should we say, compressed, they've still had to go through those stages to get to this point. And you've asked, and before you ask me it again, because you have asked me it before, would I take the vaccine myself? The answer is yes.
I was going to ask you again. I'm happy. In fact, it was Dr. Glover who convinced me on that. I'll come to her in a minute. But let's do students or people returning and this business with the mask and the 1 hour getting out for exercise. I've had various people on to me really concerned that these people, I mean, it's not just students anyway, is it? Could be walking down Strand Street because that's where they live nearby and they're going to buy a pint of milk there, and shouldn't they really be in the countryside or something? I don't know how you can go with this one, because it's a worry, isn't there, basically?
Well, the first thing I need to make clear is if someone goes in and buys a pint of milk, then basically they would be committing an offence.
Okay.
They are allowed out for 1 hour's exercise. They must social distance, so they mustn't come into contact with others.
So they shouldn't be in Strand Street then?
So they certainly shouldn't be in Strand Street brushing past people. That would be committing an offence as well. They do need to wear appropriate masks, if assuming they haven't got a medical condition, which obviously dictates that they don't need to. And it was something that was on the recommendation of our public health team, because we do have to recognise, and I said this early on in the pandemic, there is a balance. There's a balance between physical health, mental health, and it's a very hard balance to strike. But now that we are locking down whole households, we feel it is appropriate that 1 hour of exercise, and this isn't something new, by the way, we do need to remember that was available early on in the pandemic as well. And then it did get withdrawn as things moved on.
Yeah. Are we going to get back to that halfway house, do you think, at some point with this 5-day testing or whatever?
I would hope so. I mean, I've said all along that I believe we do need some form of monitoring testing out there, and I still agree with that. The question is, getting the mix of that right. So I hope that eventually we'll be able to move back to 7-day in test when the infection rate comes down in the UK.
Obviously, Liverpool today have gone to this 5-day thing. Haven't they? Test every day for 5 days.
I mean, there's a mix. That sort of testing though is very much point in time testing. So although it gives you a point in time and says everyone's fine at that point or not, then and if people are in the early days, the incubation, as we've discussed, they may not come up on a test anyway. It doesn't necessarily give you complete reassurance.
Back to people who are doing the 14 days. Do they all get knocked on the door or phone called, or is it only a percentage of the people? Because obviously it can vary, I'm guessing, from week to week, and we get more for Christmas. Will everyone be hearing from you, or
Cabinet Office. Well, it's not through me in the department. I've got to be clear. Department of Health and Social Care doesn't run that side of it. That's run by Cabinet Office.
Okay. Is it everyone though?
But my understanding is the team in Cabinet Office is gearing up for everyone to be checked upon.
Once in that 14 days?
At least once.
Of course, if they go out...
I know of people who've been checked up twice or even 3 times during the
I know some haven't been checked up at all yet. But if they go out for their hour, they should leave a note, by the way, shouldn't they, to say that they've gone out quite legitimately for their hours thing, because, otherwise they could be seen not to be there.
Well, there will be contact numbers for the individuals as well, so they will be able to get a hold of them in one form or another. Down
at the airport, there appears to be... Someone sent me a picture of what looks like heat guns on the wall. I don't know if you had any comment about that, because you said you were not for it at all.
Yeah, I'm certainly not aware of that, and they've certainly not been mandated from the Department of Health and Social Care.
Yeah, two rings.
Yeah, just to remind people of that debate which we had a while ago about heat guns. Yeah. Obviously, one of the symptoms of COVID-19 is showing a temperature, but that only works with symptomatic people. We now know, as the pandemic's moved on, about there's more spread and more people asymptomatic, so heat guns at an airport wouldn't really tell you much.
But everyone's doing it, aren't they? Almost everyone seems to be doing it.
I'll be quite honest, as I always am. I think maybe it's done for reassurance and show the public that certain countries are doing things, but I don't believe it actually adds anything. Having heat guns at a port, because it only works for those that, like I say, are symptomatic or showing a temperature. Anyone who's asymptomatic or in the early days of incubation, or not even going to show symptoms whatsoever, it won't catch them.
Okay, well, there's some sort of camera down there. We will find out what it actually seems to be doing. Part of this I need to read out. In reading the letter out, did David believe that its contents were a true and fair representation of the morale within DHSC lab or not? If he does not, then he should not have read it out. If he does, then he should have said so and not hidden behind the unnamed letter. Either way, an error of judgment. Then we can park this, I hope.
Yeah, well, as from speaking to the person, because I didn't just get the letter, I think, as I've mentioned before, they had left me a contact number. I spoke to them. Certainly, having spoke to them, they said they felt there was a drop in morale. Which is why I said I would share it. Whether it's a lapse in judgment or what have you, fair enough.
That's
if people want
to, you almost say you might be wrong. Then.
No. Well, like I say, as I said on our Sunday panel debate, the thing I do regret is that it's become such a news story and dominated the news cycle with the fact that there's so many more things out there that I think are much more newsworthy.
And I'm sure you've had many other letters since then with the opposite views or something. Are you never going to read any other out to balance it up?
Actually, I haven't received any letters with the opposite view. I think probably after the publicity this letter's had, it's probably put people off writing to me for life in some cases.
Yeah. Oh well, I think we're almost done on this week. I mean, obviously on Thursday you'll have a press conference, but the numbers. Anything else since reporting this little cluster? Any more news on this? Any increase?
No, not as yet. It's still under control. What we have seen is cases, and I know this has confused people, saying, "Well, how can you still be getting cases off the back of the cluster?"
I was going to ask that.
But don't forget that we've got people who may have identified as positive off the cluster, who are then isolating now with their whole household. So other household members who are already isolated have been coming back as positive.
Well, we got Guernsey is our sort of neighbour who was on the same track. We haven't had any sort of signs of an airbridge coming back. Is that likely to?
I would hope so. I would like to see the airbridge back.
The levels okay down there?
The levels are fine down there, and obviously we've got a cluster as well. We've mirrored Guernsey, so I think there will be talks in the future for us to re-establish the airbridge. Both jurisdictions have worked very hard to get to the place that they are. And I think it's a good opportunity for us again to share our common lands. And I know people have enjoyed going down to Guernsey, and I know of Guernsey residents that have really enjoyed coming here to the island.
And finally, with the UK, or England anyway, coming out of full lockdown in the beginning of December, it would still take a long way to go before we're going to have any sort of interaction, presumably with the UK, because of until the numbers are way down. You're not going to revisit that or have a Christmas special or anything like that for getting people in.
No, I think doing a Christmas special, as you put it, I don't think the science behind it and also the potential impact on the community would actually allow for that. We've said all along that our decisions will be based around the infection rate in the UK. There's some positive signs being seen, particularly around the Liverpool area, where there was announced yesterday it was expected the R number is below 1, but the infection rate we still have to recognise is still an awful lot higher than it was even a couple of months ago.
And these students all in for Christmas, we all hope it all goes well for them and everybody else. And in your thoughts, vaccination, well, I think the UK was saying that by summer they were being pushed this morning, Hancock was being pushed, but it wasn't Easter, it was more like summer we could see normality.
I mean, again, I'm going to put my cautious hat on again. It's far too early to say. I mean, vaccination programmes, while it all sounds great, these things do take time to roll out. Yeah. So even where you have a vaccine, so for instance, a couple of the vaccines, they have to be stored at low temperatures. They don't come as single doses. They come in vials of 5 or 8 doses, which then have to be pre-mixed. Then once they're mixed, you've got 2 hours to deliver it to into the person, or they're wasted, basically. So there's a huge logistical issue behind vaccination as well. We've got to remember this is going to be the biggest vaccination programme that the world has ever really seen. And
Nobles, or whatever, your sister was geared up for that. I think I've asked you that already.
Yeah, but, we'll be looking not just at using Nobles, we'll be looking at other sites around the island as well to be able to deliver it.